If you're thinking about getting a hair transplant, then there are two techniques that should be at the top of your list, FUT and FUE. Today, we're going to explore FUT, Follicular Unit Transplantation. This is foundational to hair transplants, and we think it's a technique that still should continue to be used. There's a lot of controversy though, because there are surgeons who do only FUT procedures and only FUE procedures. We're in the camp of doing both. So today what we're going to do with you is explain what this procedure is all about, why you should consider using this technique when you get your hair transplant, if you're a great candidate, who's not a great candidate, and of course we're going to explore complications and how to avoid complications. So who is an ideal candidate to have a strip technique? Well, first and foremost, we have to make sure that you have great donor supply. If your hair follicles are weak in the back of your scalp, well, we have to look at other parts of your body, and in that case, we can't perform an FUT procedure. We have to explore other options. The next thing we have to do is look at whether your scalp is actually able to move, if it has elasticity. If it doesn't, it potentially can cause complications when we do a strip technique. Now, if you're a male who likes to wear your hair really short, this is not going to be your option. If you're a male like me, I wear my hair longer, great. FUT is a wonderful option. And for females, certainly an option because you don't have to shave the entire back of your scalp.
So what is FUT? It's actually taking hair from the back of the head in what's called the safe zone. There's a strip taken that's 1 centimeter in diameter and approximately 20 centimeters in length. And this hair is then taken and microscopically divided up into 1, 2, or 3, or 4 follicle units by a technician under a microscope. And this hair is then transplanted to the front of the head. We create recipient sites in the front, and these little fine hairs are plugged into these areas in the front or on the crown of the head.
I want to point out something that's very important. The hair in the front of our scalp looks very similar to the hair in the back, but I have a surprise for you. It's different. The hair in the back of our scalp is less sensitive to a hormone known as DHT, and this hormone is a major contributor for hair loss. And actually, the hair in the front of our scalp is more sensitive to DHT. That's why you see hair loss in the front for both men and women. Now, when we perform an FUT procedure, when we take hair from that safe zone, this hair is less sensitive to DHT, and you can transplant it right to the front, and guess what? It won't respond to DHT. It won't fall out as easily. And that's why hair transplants work, and that's why an FUT procedure really is a great option if you want to restore your hair.
There are 3 advantages of an FUT procedure that are dominant. One is that the follicles that are removed in a strip procedure are plumper, and therefore the quality of the graft is better, and there's fewer transections of the hair follicles that may occur during the dicing of the hair follicles up by the technician, compared to these newer techniques which actually have a higher transection rate where the hair follicle is lysed during the extraction of the hair follicle. That is very important because in FUT there are greater numbers of viable hair follicles that can be then transplanted to the front of the head. Whereas if you have a higher transection rate, there's going to be fewer viable hair follicles that could be utilized for your transplant.
And I think a third big reason, and patients really love this, is that they don't have to shave the entire back of their scalp like the newer techniques. So this is great if you're a woman or if you're a male, because really at the end of the day, you go into the hair transplant with an FUT and you walk out with your entire back of your hair still kind of hiding that incision. So people really like leaving the procedure not really with the perception that they had hair transplant.
So there's been a lot of apprehension about having FUT procedures as if they're old techniques and they don't have the validity now in the 21st century. That is false, okay? The reason why people were hesitant is that they've seen pictures on the internet and other places where they see these ugly scars in the back of the head. And there's a good reason that those scars formed. Usually, it is a technique-dependent complication, meaning that the surgeon tried to take too wide a strip out and create tension between the edges of that closure. Okay, because after we take the strip out, we close the wound with either sutures or staples. Okay, but if there's a lot of tension during that closure, it can cause a hypertrophic scar along that line and can obviously be visible. So that is a surgeon-based complication in most cases. Some patients, however, do have a tendency to scar to a greater degree than others. But in most cases, it's a surgeon-dependent complication. The second reason that people have complications is that there's a tendency to form keloids. Keloids are really exuberant scarring that can occur in some patients. Usually they are black patients develop keloids. It is also possible a Caucasian patient can develop keloids. That's different than a hypertrophic scar. It is a scar that actually blooms, so to speak, and that can usually be avoided by selecting out the patients before the surgery takes place by getting a good history of whether or not they are keloid formers. How do we actually get a fine incision at the site of the strip? We use what is called a trichophytic closure. A trichophytic closure means that we take actually the lower edge of the strip and we take a little piece of that tissue off and allow the upper portion of the strip to overlap that raw area, and that allows some of the hair follicles to actually grow through the scar itself so that there's less noticeable scarring in the back of the head. We also sometimes have to use other techniques to reduce scarring. Sometimes we inject Kenalog, which is a steroid, and sometimes we use something called 5-FU, which also can reduce scarring in the back of the head. But usually we get great results because we don't take too wide a strip out initially. And that's the key decision that has to be made by the surgeon so that you don't have a lot of tension at the wound, and which results in an undesirable outcome.
FUT is an older approach to addressing hair loss, but yet it has a tremendous amount of validity, and it's a great technique for hair transplants. We perform this in our practice all the time, and we see great results. With that said, we understand that patients are concerned about developing a scar in the back of the scalp, but that really boils down to the competence of the physician. And we also know that this procedure is not ideal for patients who want to wear short hair. Now, I should emphasize the following. Sometimes we use combination therapy in addition to FUT to get the best results. And that's ultimately our goal. You want to get a hair transplant where you're getting the maximum amount of density and coverage for your scalp. So, if you have any questions about FUT that we have not addressed today, please leave them in the questions below. We will do our best to answer them, and please check out our next video.